this video, we'll review the health history panes located to the left-hand side of the patient's medical record. The health history panes provide access to different applications for reviewing, entering, and editing patient information. When a patient's chart is opened, it will open up to the chart summary. This is a view-only window which displays the patient's medical information. As you can see here on the chart summary, on the top left you have the patient's name, their chart number, date of birth, and gender. Across the top here you have the encounter in which is connected to that patient's particular visit. You also have your medications, allergies, and problems. If you hover and click on the numbers listed there, it actually displays a list for each one of those choices. You also have a notes section, which is not part of the medical record. It is just a way to jot down a note as a way to remember something that needs to be done on a patient's record if need be, or a note to advise the patient or something. You'll notice that my note section here is highlighted in blue. And if I click on that, it's going to show the note that was created. To add that note, I would just hit a plus sign next to the add note. It already has the user listed here. That's the user that's logged in. And then type in the note that you want to save as part of that chart summary. And again, this does not print out as part of the medical record. So if there's anything that needs to be part of the patient's medical record, it should not be added here. This is just a quick reminder. Make sure to give the patient labs before they leave for instances like that. And then you would press save. And then you'll notice next to that, it has a little icon of a person and then the person's username. This is the person who is logged in to CareTracker at the time of the session. Below that, you have your clinical toolbar, which is discussed in another video. Each one of these buttons here, what they are. You also have the patient's PCP, their insurance if it's listed, their next appointment, their last appointment as well. Now on the chart summary, you can filter this by time frame if you want to see everything. You want to see a particular case if this particular patient has a case connected to their chart, or you can do a custom date range. You can also view this chart summary in either 3 columns, 2 columns, or in chronological order. You can customize this view based off of the user who is logged in here as well, just by selecting this little cogwheel here on the right-hand side. When you select that, it opens up to how you want to see this, your time frame. If you want to see last encounter, past 6 months, past year, if you want to see it only in 1 column or 2 columns, even if in chronological order. Underneath that, you have the ability to select what you would like to see on that chart summary. Maybe your office does not do any immunizations, so there's no need to have an immunization pane there. Maybe you do not want to see any type of devices because your office does not do anything with devices, doesn't keep track of that type of information. You just uncheck what you do not want to see on your chart summary. The only thing that cannot be unchecked is your open activities. And this is because those are activities that still need to be addressed for that particular patient, so you're not able to uncheck that. Below this, you have your operated settings. You have the ability to open up a progress note into a new tab when you click on the progress note clinical tool button. And that would open up your progress note into a brand new tab instead of having to close out of that to come back to your chart summary. Your default order type is set to lab, but you can actually have it set to diagnostic imaging or procedure. If you do one over the other more so, you can change which one you want to have that open up to when you click on the order clinical tool. You can also collapse your menu on the medical record, which would give you more real estate on the chart summary when you open up a chart. So if I was to click this here, and I will press save in a minute to show you what that means, to give you more real estate. Your default patient education. Where do you want that clinical toolbar to land when you open it up? Do you want to search for your patient education? Do you want to use the tree feature when you're searching? Do you have your favorites already set, so you just want to go automatically to your favorites and click which information you want to provide? Or are you using the links feature that's inside of CareTracker? You also can default What you see, is it for clinical today appointments or medical records? And then if your practice is scanning in patients' pictures, you can display the patient picture right here on the top left when the chart is opened if you have this check mark checked. Once you've selected your choices, you would just press save. And again, that's based off a user inside a CareTracker, not company. So who's ever logged in for that session, you would be setting those user options there. Now I'm going to click out of my patient's chart and I'm going to go into another patient's chart just to show you about the expanding and collapsing of the chart summary. You'll notice that I had selected the collapse menu, medical record open, as part of my default. So when I opened up that patient's chart, my health history panes now are collapsed, and it's just showing me the different icons for each option within my health history panes. It's now giving me a bigger view of my chart summary. If I don't like that, I can always go back into my default settings underneath my cogwheels, uncheck that, and press save. And next time that I open up my patient's chart, it could be any patient, it will now change back to the original size that I had it before. Now also, with the expand and collapse, you can also select this little arrow right here next to the time frame, and that will do the same functionality because you might be looking for something and you might not want this to be set as a default. So it might be a one-time thing, and then you can just click back to make it back to the regular size. Now, again, there is an option for view to do it in chronological. It's not a recommended workflow to use the chronological unless you are looking for a specific date. If you're looking for something on a patient's chart for a specific date, date range, then you could switch this to the chronological section and it would put everything into chronological order on that patient. Now, based on how much information is listed in that patient, it could take a minute or two. I do have everything, for the most part, checked. So you can see here that it's now take each pane and it's putting them into chronological order for me. And if I'm looking for a specific date for something, I could change this and use this way of looking for things, but it's not a recommended workflow because, as you can see, it's kind of all looped together as one. Recommended would be either one column, two columns, or three columns. So I'm going to change this back to my 3 columns. And it just makes it a little bit easier for me. Now, with the chart summary, you can click on any one of these panes and it will open up to that health history pane correlating on the left-hand side as well too. That is an option with inside the chart summary. Or you can just click on the health history choice on the health history pane here on the left-hand side as well. Now, problems list, medications, and allergies, we're not going to go into too much detail on this video with. They are covered underneath the ERX video because they are part of when you're prescribing a medication, how they should be checked and updated at that point. But again, the problems list is a chronologic and ongoing patient problems, helps a user add or edit the diagnosis for a patient. The next one is your medications here. Medication displays all prescribed medications for a patient, either from the provider or from other providers. That medication can be pulled into the system using that request med history. And then you have your allergies as well. And allergies is a list of the patient's allergies. You know, what are they allergic to? What are their reactions to that particular allergen? And again, problems list, medications, and allergies are fully reviewed in the ERX video. So moving on to immunizations. Now, immunizations underneath the health history panes are immunizations that have been administered. Not that somebody in the practice is actually administering that immunization to a patient. These are ones that have been done. So if a patient went to a flu clinic and you want to document that they had the immunization, you can do so underneath here. Starting with your time frame, you have a way that you can view The immunizations here, you can do all. You can do it by last encounter, past 6 months, past year. We also have immunization schedules here as well. We have the adult schedule. It brings you out to the CDC. So based on age, it will give you the immunization schedule. We also have it for child as well. So again, based on age, up to 18 years of age. You also have your history and forecasting. This is used if you're completing the MIPS program. You will want to have access to this here. You'll be given a username and a password. And this is for you to be able to log in and see through the registry what has been sent to the registry for that particular patient. You also have where you can enter in a past immunization, or maybe a patient refused to receive that immunization. You would select this plus sign here. And that's going to open up to this screen here where now you can document that particular immunization. You would be able to put in a CPT code or search by description. And again, you have begins with, contains, or CPT. So if there's a CPT code attached to that particular immunization, you could use that in the search field here and then press search. So I just put in influ for influenza. So now I'm able to select which particular immunization that the patient was given. Now again, I keep using the word was because this is historical information. I'm not giving this immunization to the patient. So once I select the medication, I can now select the manufacturer, lot number if I have it. Now again, you might not be the one or the practice administering this immunization to the patient, so you might not know who the manufacturer is or the lot number. You might not even know who the what the expiration date is. You might know when it was administered because the patient might say, yeah, I was given, the flu shot at the flu clinic on October 1st. If it was something or an immunization that was administered in the practice and wasn't documented at the time, you could always select administered by and fill out the information above. If there was an ordering provider, information source. Is it something that the patient refused? So if they refuse to get it, you have recommended it based off of various different things within their medical history, and they've refused, you can now say that they refused this. So that way it's documented that the patient actually refused the recommendation. Status, is this an active immunization? And if you know the dosing route, the amount, of course the series, if it's an immunization that requires a certain amount of dosages. And then you would press save. And that would enter into this screen here, which shows you the list of immunizations for that particular patient. So you'll see here you have the immunization name, the CPT code associated with it, the date that was entered in as far as being administered, the admin provider. If there was a series related to it, it would be listed here, the amount that was administered. Did they refuse? If they did, it would have a yes next to it here. As you can see on the bottom one here, it does have a yes that they refused their tetanus shot. Now you also have an action button here, or action triangle, that allows you to be able to edit if you needed to. So you could edit that information if need be. You also can mark it erroneous. Maybe it was entered in by mistake. Maybe this wasn't the correct patient. It was entered in by mistake. You can mark it erroneous, so that way it leaves the patient's medical record. You might want to see if it was transmitted to the registry, so you can check the transmission status, and you can also check the log as well. Now, CareTracker has a great auditing system. Various different places within inside of the product, you're able to see the log of who entered it in, who's opened it up, who's made changes of that particular item, just by selecting the log information here. You also have the ability to send to the registry if it needs to be resent to the registry, just by putting a check mark in next to the patient's immunization here, and then selecting the Send to Registry button that will gray on top here. Now, right now, this is opening up. It's going through the system to open up to the log. That's why it's taking a minute. And it will not let me change the screen. As you can see here, the log is now populated, and it's based off of a to and from date. This date can be changed if need be, if you're looking for a specific date range to see if something was done for that particular immunization that has been entered in. You can also do it by operator as well too. And then you would just select show log, and below it would show you the information that is listed here. As you can see here, it's telling you that on October 23rd, who the user is, the immunization was accessed, and what IP address accessed that information. And again, if you need to retransmit a immunization to the registry and you are hooked up with your registry, interface with your registry, you can just put a check mark in this and select send to registry. And that will allow the user to send that to the particular registry. You'll also notice here on the right-hand side, you have a document section. So if you are scanning in documents and you have assigned it as your subfolder to appear within inside of your immunizations, it will show up underneath this document section here. Also, you can print from each section here, and as we go through the sections, the print options will change. So if I select my print option here, you'll see being in the immunization section, the only option I have is to print my immunizations. Your next health history pane is your vital signs. This is where whoever is rooming the patient and taking those vital signs would be able to enter in the vital signs. This is based off of height, weight, blood pressure. So to record your vital signs, you can select record vital signs here, and it'll open up to an additional screen. In this screen here, we do have the disclaimer about ECQM. So if you're participating in the MIPS program, letting anybody know that, blood pressure higher than 120/80, it requires a follow-up plan documented to satisfy that measure. Nutrition counseling, physical activity counseling in the plan section or the quality tab. When you enter in the height and weight, it automatically calculates the BMI for you here. You also have finding details information here. If you click on the little piece of paper with an arrow, that allows the user to add in additional information for that particular section. Blood pressure. If your practice takes a pulse rate, temperature, respiratory rate, you can add that information here as well. If you are tracking information last menstrual period, you can enter that information here as well too. You can enter in why they're being seen in the office today. What is the reason why they're being seen? It could be a follow-up, it could be a physical, it could be, 6-month follow-up, it could be because they're complaining of chest pains. That can all be typed in here. And then you can save. Now, if in the event that you need to retake a blood pressure because the patient might be very nervous and their blood pressure is very high at the time that the blood pressure was originally taken, you can always select save and add new. And that will save that information for the first blood pressure and clear out the screen for you now to take that second blood pressure. You would just take the blood pressure again and add that in to the blood pressure area here, and then you'll be able to save. You do have the ability to copy values from a prior record if need be. And close. Care Tracker also has the ability to do home monitoring as well too. This is a feature that would need to be set up for the practice. So if this is something that your practice does and has patients who monitor their blood pressure at home and you'd like to track it part of their medical record, please reach out to your support entity and we can have that turned on for you. Home monitoring. To enter, you would just click on the home monitoring button. You'll notice that it doesn't have as much information as it does if you were taking that vital signs in BMI and everything inside the office. You would just enter in that blood pressure, weight if they provide that to you, temperature, and so forth, and then you can just press save. And that will now become part of the record here. There's different ways that you can filter what you see on the screen here. You can see them all. You can see just the last encounter. If they have a case, you can do by cases, the last 6 months, the past year. This list here will grow on and on and on and on since the first vital sign that was taken for that patient till current day. So however long they've been a patient within your practice and you've been using CareTracker is how long that you will see vital signs for here. Anytime that they're highlighted in a red is an abnormal number. And it's just a way for the system to kind of alert the user to kind of look at that particular measurement and to keep an eye on it. You can also include it all, if you want to see all of your patients in office or at home, or you just want to see the recorded at home. You'll notice that if it's recorded at home, it has an HM on the parentheses right here to indicate that this was a blood pressure that was done at home. And if it's recorded in the office, it'll just have a 1 underneath it. Or it could have a 3 because it was taken 3 times. Or it could have a 2 if you're retaking that blood pressure again. Also, how you want to see this. Do you want to see it horizontally across the screen or do you want to see it vertically across the screen? And again, that is also a user preference. So if one user chooses to see it vertically because they like the way that this looks, it's more compact, then another user can still use it on their screen as a horizontal and it doesn't affect the workflow of anybody inside the practice. The printing from this screen here, you can print out the vital signs or a vital sign form. So you'll notice as we go through the different screens here, you can print different things. Progress notes, we're not going to go too much into. That's actually covered underneath how to document a progress note video. But these are where the progress notes will be housed when it's created, either signed off or not signed off. The next tab here is your devices tab. This is a fairly new health history pane for CareTracker. It was implemented for Meaningful Use Stage 2. So it's been around for a little bit. And this is so that way practices who do, surgical implants can have a place to document and track the implants that they've implanted into a patient or a medical device that a patient is using. You'll see here you can view it again. You have a view option, all, canceled, completed, if they've been discontinued, failed, inactive. Below here, once it's entered in, it will show you the preferred name for that particular device. Every device has a device identifier, so that's what's entered in. Lot or batch number, a serial number, expiration date, manufacturer date, brand, company, version model, if it's active, and if it's been modified. You can always view additional information with it as well by clicking on the little piece of paper here. It just gives you some additional information on that. To add in a device, you just select the plus add device here, and you're going to enter in that device identifier that's been provided to the patient. Now it could be, they had a surgical procedure and they were given a card when they were discharged with that information. That's how you would start. You would add in that information, and then it's going to ask you to add in the lot number, the serial number, and all that information should be on some information that was provided to the patient. Now again, this might not be for everybody. Not everybody keeps track of devices, or it's not part of the scope of their practice. If you need to change your status, you just put a check mark in what you need to change, and then select from the drop down here. Is it completed? Is it been discontinued? Did it fail? Is this something where we need to contact the patient and let them know they have to come back in? That's another reason why it was added in, as for a tracking purpose. Moving on to encounters. Now remember, anything that's being done to a patient or for a patient is considered an encounter. It's not necessarily a progress note. It could be a telephone call. It could be considered an encounter. A renewal of a prescription could be considered an encounter. This more so here, as far as an encounter, is more to deal with anything that requires like a note in a bill for that particular data service, whatever is given to or assigned to that particular encounter type. This will be actually more discussed with inside of the progress note video. The next tab here is your documents tab. This is your document management for the patient. This is where the documents that have been scanned in for that particular patient would be housed. Very similar to if you were scanning in documents for the practice or for the demographics, such as the patient's license, healthcare card, new paperwork. You'll see here you can search by subtypes. Those are subtype folders. You can search by case if there's a case assigned to that particular patient. State, is it something that's been completed? Is it an error? Is it still open? Provider, because sometimes there's multiple providers in a practice and the patient might see multiple providers. They might not see the same provider all the time. You can also do a date range to and from. You can view these folders by a folder tiles, a folder list, or a work list. You also have cogwheels. So anytime that you see any type of cogwheels within inside a care tracker, it means that this screen or area that you're in is customizable. And what we mean by customizable is customizable by the user. That's who's logged in to that session. So when you click on the cogwheels in the documents section, we have the ability to view this as a work list, folder list, or folder tiles for your health record. For your document manager, again, work list, folder tiles. The metadata within inside of that scanned image, do we want it to be expanded or collapsed? And I'll show you what I mean by metadata in a minute. And then your document default view, is it a best fit? Is it fit to height, fit to width, or fit to size? Now that means the fit to your screen, your computer screen. So if you're on a laptop and it's only 15-inch screen, and you have it fit to size, it's going to fit to the 15 inches of that screen. If you're working on a little Surface Pro, that might be 7-inch screen, could be even a little bit smaller, then it's going to fit to that size. So that's what that means here. You also have the ability to kind of play around with your colors if you want by selecting different colors here. That is totally up to the user if they want to play around with the colors there. Once you've made your decision, you would press save. So below here, you'll see that my documents are in a folder list. If I want to see folder tiles, I can click on that and it kind of puts it into a tile formation for me. And also I could do a work list. Now work list kind of looks cluttered on my screen here. Again, work list, if I'm looking for a particular date, maybe a particular document, I could do a work list so I could kind of scroll through faster than going through each individual folder. I could just scroll through and then locate that particular document that I'm looking for that particular date. It's not really recommended as your default, but some people like this view, so it's there if they prefer that. And again, it's based on user who is logged in, so whoever name is located up here on the top right is whose settings would be set for. I'm going to switch mine back to folder list. If it's in a folder list, you can hit the plus sign next to the folder and that expands that folder out. So that way you can see the subtype underneath it. So it gives you the subtype that's there, the patient's name, of course, of who that we're in. What state is it in? Is it open? Is it completed? If there's a provider attached to it. That encounter date. If it's part of the group, it would show you the group. If this has been recorded, has it been signed? And then if there's any type of note on there, this would be highlighted blue, this little printer screen here. Now to add in a new document to this particular patient, you can select the add document here. And it's going to bring you into the upload screen. Now, if you have a document that's been scanned to your computer, because maybe your scanner is set up to scan directly to your computer into a particular folder, you can use the upload document feature here. You would just select browse, locate where that folder is on your computer, and then be able to click on it and pull that in. Now, if you have a scanner that has Twain drivers, Twain drivers, you can connect that to CareTracker system. Once that is selected, on each computer that needs to be or will be scanning in, you just select the word scan. For the very first time that you're doing that, you're going to receive this little pop-up here letting you know that this little piece of software needs to be installed on that computer. And this is computer by computer based. It's a one-time install. You just select install and follow the prompts through the wizard. And that way you'd be able to scan directly from the scanner into CareTracker. Then you would select your document type, your document subtype. The patient's already listed here for you. My provider is already listed for me because that's the provider that's listed in my batch. If it's somebody, a different provider, I can select them from the drop down here, the provider in the practice. If I want this to be part of the group, if I'm part of a bigger group, I can select which group. If I want to link this to a particular encounter, I can select the encounter date as well too. I can give it a batch, a document name, document date. I can also make this a confidential note. So if this is a confidential note that I'm scanning in, maybe it has some very sensitive information about the patient and only certain people are allowed to see that based off of their operator role, I can make this a confidential note so they are the only ones that are able to see it. Was this reviewed by the provider already, or do they need to review it? If they've already reviewed it, have they technically signed it off? I can say yes or no, or is it something that they need to sign off? And then do I want it to show in the chart section? So whatever section I select here, again, if it's immunizations, problems, medications, I could select it from here. I can put it part of my problems list, and you'll see my chart section. It will show up in my problems list. So I can say yes, and I would just add my document. Now, to create your folders and subfolders, that is done under the administration for CareTracker, and that's actually reviewed in its full detail underneath the clinical tools video. Moving on to the orders and referrals over here on the health history panes. These are where the orders are housed once they're created with inside of CareTracker. You'll see here, I can choose which time frame that I want to select and view the orders that have been created. Again, last encounter, if there's a case assigned to the patient, and the cases are assigned to patients, depending each patient. So not every patient might have a case. If I want to see past 6 months, past year, I can also on my status here see all or only my open ones or my complete. You'll see my documents pane here. My documents pane, if I had scanned anything into documents and I've designated my order section to be there, it would show up in this pane here, and there'll be a little folder here. You'll see that each order has an order number. So when an order is generated inside of CareTracker, it's automatically given an order number for tracking purposes. This is the date of that order, which type it is. Is it a lab, procedure, radiology? What the test description is, the provider who is ordering that particular order, the encounter date that it is linked to, if there was a diagnosis code placed on the order, if there was any type of notes, they would be highlighted in blue here. And then I also have an action triangle here. So I could view an image if there was an image linked to it. I can print this out again. I can enter in results. So if I have an in-house lab and they walk over the results to me for a metabolic panel, I could enter in those results manually because I might not have an interface with them because they're in my office. I could manually enter in those results. I could copy this order if I needed to. I could link results. So when a result is received electronically from a lab company and it's reviewed by the provider and signed off, it would need to be linked back to the original order. So here's my option to be able to link that to the particular order, to the result. So when I select that link button, it brings up all of the results for that particular patient. And I can find which one it belongs to and select the word link here. And that would link the order to the result, closing out that open order. I can also fax an order if I needed to, if I am with using our third party MyFax. I can fax out a CareTracker and I can fax that result. And again, we have that log. And you'll see a log throughout CareTracker because that's part of the ordering process of CareTracker, showing you who created the order, when it was touched, when it was changed, when it was printed. If I ever needed to show my inactive orders, I can click on the show inactive and it will populate, most likely on the bottom of this screen here. So I have a lot of orders in here that have not been closed out. I can select all, which is going to put check marks in all of these here, and I can mark these complete if I needed to. Not a recommended workflow because you want to make sure, in fact, that a patient has gone for the recommended lab or radiology or a procedure before you close out their particular order. I can also hit none. That would take the check marks out. I also can print from here. I can only print the patient's orders from this screen as well. We have referrals here as well too. This is the outgoing referrals, also incoming referrals of where they're housed once they're created or received. My time frame, how I want to view this screen here. My status, do I want to see them all? Do I only want to see incoming or outgoing? Again, I have my documents over here, so if something's scanned in with that referral and I've designated to come into the referrals pane, it would show up here. Everything in CareTracker gets some type of identification number in some form. So here for your referrals in your ingoing and outgoing, you have a number, referral number. It gives you the type, referring from, referring to, if there's a status, the authorization, if it's pending, authorization date. You can print that out if need be. And you can also send it as a to-do as well. You could send this as a to-do for somebody to follow up on that. Did the patient follow up with their referral to the specialist, physical therapy, if need be. The next health history pane here is your results pane. This is where the results will be housed for that individual patient. Now on your Clinical Today screen, you do have a results underneath your quick task for results, which is a company results based off of the provider in your batch. This here is for the individual patient because you are inside the patient's chart. So this is where the results are housed. You have your time frame of how you want to review these results. Result types, is it labs or radiology? You can select the provider. So if you're working for multiple providers and you're only looking at one provider's labs, if you're looking for something, you could select that one provider and be able to search just for that particular provider's labs that were ordered. Results that were received, I should say. You can also select all again here, puts a check mark in all of those boxes or none. I'm going to take out his name and I'm going to leave it blank so that way it shows all of those lab results for me. I put back in everybody there. So you'll see here it gives you the reported date, the collected date, the patient. Now we have this patient's considered at one point in time a VIP. So anybody who has the VIP overrides on their operators and roles would be able to see that information. If they don't have that operator and role, then you're not able to look at that particular information for that patient because they're considered VIP. Their gender, date of birth, the type, lab, could be a rad, radiology, the facility of where the patient went, the provider who ordered it, the status, if this was signed off or not, yes or no. Then you have your little eyeglasses that allows you to view the linked order, whereas you have a little circle with these two little pointy on each side, which allows you to link that order, to link the result to the order. You can also link to a document as well too, And then you also have the arrow here that allows you to either print it, put it in a to-do, or look at the log. Now, anytime that you see a description in red means that it's abnormal. So if you click on it, it will open up that result and it will show you the abnormal result there, also highlighted in red. If you see this little piece of paper right here attached to a result, that means that that result was scanned in. It wasn't received electronically through a interface. So that's something that is scanned in. So you'll see here, this is the scanned document that was scanned in as a result. If I expand this here, this shows me the metadata that I want to see. I can have this collapsed as a default, or I can have it expanded. You're able to edit if need be. The document name, when it was uploaded, if it's a clinical lab result, document date, you could add a note to it if you need be. You could also mark this as signed when it was scanned in. Mark reviewed if this is active. You can also print these out here. This, again, is a scanned in image. And that's what that little piece of paper there, icon looking, is for. Now, when you have something like this that's scanned in as a lab result, that's not considered structured data. That is considered a PDF, and the system can't read a PDF as structured data. So if you're doing anything with MIPS that requires any type of labs being read as structured data, A1C, hemoglobin A1C would be an example of that. For an ECQM, that would not count if you're scanning in a lab result, because the system, again, cannot read a PDF as structured data. So you would have to manually enter in the results for that particular order, or if you're interfaced, receive them electronically. In this screen here, as far as printing, you can print lab results or radiology results. You also have the ability to filter by abnormal only. So if you're looking for a particular result and you might have said, this was an abnormal result, I just don't remember the date, you can always display it by show abnormal only. You can also view by showing only ones that have been unsigned. They haven't been signed yet by the provider. You do have the ability to commit them all or sign off on them all at once, not a recommended workflow. But you can select the all button here and then select commit results, and that would commit all of these at once. And again, it's not a recommended workflow, especially depending on if something's abnormal within that lab result. The next pane is your history pane. And history pane is patient information such as family, past and social history. It enables a practice to record more information on the patient. So going from left to right here, you have the patient history, you have sensitive information, such as if they were HIV positive, you could document that information underneath the sensitive information. You have the ability to document family history, mother, father, sister, brother, and you can get detailed with that as well. You could actually name each relative if need be. Advanced directive, any attachments, and again, there's a log here, so it shows every time that this has been accessed, what has been entered, and what has not. You'll see here on the top, you have your reviewed. If I was to check, my medication was reviewed, my allergy list was reviewed, these would have check marks in them already. So now I have my past medical history here. A couple of ways that you can document. You can clear out all that information here, and it will leave it blank. And you could put in, plus signs and then go through and uncheck the ones that don't apply. If you want to be that detailed, you can also come in and just check the ones that do apply for the patient. Sometimes they might require a date to be entered. You also have your finding details here as well. With the finding details section, depending on what your choice is, there may be more additional choices. So you can get more detailed on that particular topic. So in this case here, cancer, I can now describe what type of cancer it is. I can also put in any type of free text notes that I want as well. We also have a section here if you want to put in additional information for hospitalizations or medical history. We have our smoking cessation here. If you're doing any type of ECQMs, you'll see that a lot of these different choices here are related to different ECQMs for the MIPS program. Sometimes there's a drop down for that particular area. Again, a date could be a yes or no. And in the finding details, depending on what it is, you might have additional choices, or you might just have a text box, depending on what that choice is. And again, this is up to the practice and the scope of the practice. This might be information that the practice does not obtain from the patient. And if that's the case, then you don't need to utilize the history pane, but it is here if it is something that you are doing. Again, if you are doing anything for ECQMs or MIPS, there are different sections in here that would need to be filled out depending on which ECQM measure you are participating with. You have your advanced care planning. You have your falls prevention, OBGYN history. Now, one thing to note, CareTracker does not discriminate. Male, female, does not delineate male, female. So if you're in a male's chart, you're going to see information for a female. If you are in a female's chart, you'll see information for a male. It's kind of grouped together. So do not get alarmed if you do see that. We have our cardiac history, surgical procedure, depression, and then you have your preventative care. So if you're keeping track of the last time the patient had a flu shot, maybe the last time they had their mammogram, last time they had their pneumococcal vaccine, last time they had a bone density, their A1C percentage, the last time they've had that test, maybe it's an HPV test if you are, an OB, you can put in the date here. And again, there is different text boxes here for free text if you needed to add in additional information as well. You have your functional assessment, and then you also have patient-provided information to you. So if you wanted to give it a title, and then type out what that patient provided to you. You can save, mark it as reviewed, and it now becomes part of the patient's medical history. Again, sensitive information here. Depends on what the sensitive information is for that patient, but it would be here. This does not come over or go over to the progress note. The patient history, if it's filled out here, will move over to the progress note. So that way the provider would be able to see that when they are dictating their note. But you have your substance abuse, mental health, again, HIV status, even Medicare high risk is listed here on the bottom. Family history, do you have a family history of anemia? Do you have a family history of hypertension? Do you have a family history of cancer? You can actually add in the relationship of the family member to you, and you can give them a name as well. So depending on how precise you want to be for that medical record is totally up to you and the scope of that practice. It's not a requirement, it's just an added feature. Advanced directive is actually handled on the PM side of CareTracker, but this is where you would see it if it was entered in. Again, attachments and log. I'm not going to open up the log only because it would take a long time for it to generate because it's going through the whole system looking at the log. Moving on to flow sheets. Flow sheets are a way to be able to graph different things that you might be looking for. You have the ability to view a vertical grid or a horizontal grid, a chart, a form. You work this screen from left to right. You can include different profiles. So we have different built-in flow sheets already. Let's see if I can find one that will show you. We also have the ACOGs as well. And you also have the ability to create as well too. You can select your items of what you want to see. You can select all. You can just select certain things. You have the ability to enter in or include different lab results as well too. Cases, if there's cases linked to that patient. Anytime that you save or view, they would be listed here where you are able to just click on them and see them again. Your little heart feature here allows you to save them. You can look up different flow sheets that we have here. And again, flow sheets are not for everybody. Some people really like flow sheets, depending if they're doing like Botox injections, INR levels for Coumadin is a great way to use a flow sheet. And as far as your flow sheet, you can print out a flow sheet, is what you're able to print out here. The next health history pane is your correspondence pane here. Correspondence pane is basically just that, correspondence. Was there a letter created and printed on the patient's chart? Patient education given. Was there a to-do with the patient's name linked in that to-do? Was there a chart summary that was printed for the patient? So any type of correspondence for the patient would be housed here. You can search by date, range, last month, year, encounter, to and from date range. You can print out a correspondence log. You can add in new correspondence if you wanted to. You'll see here it gives you the printed date, the created date, the type of correspondence it is, the notes to that, what it is, if it's linked to an encounter. If it's linked to a to-do, you have a to-do number, the operator who created that, if it was printed. You also can set as an inactive as well. You can show unprinted only. You could show your inactive as well. One thing to note with the correspondence section, when you go to add in a correspondence here underneath your type, there is a phone call option. This is very important to note. This phone call option, if a patient is calling into the practice and leaving a message and needs either an MA, a nurse, or a provider to call them back because they're waiting on either results or they need a follow-up via phone, this is not the place to document that phone call. When it's documented in here as a phone call type, it only stays here in correspondence. There's no way to alert or send to somebody in the practice that this patient had called and needs a call back. This is a documentation purpose only, and it's not for the use of phone calls if you need to have a phone call back for that patient. It's not recommended at all to be documented here. That should be documented as an encounter for that patient. As far as printing, you'll notice that you're not able to print anything out from this section here at all. The last health history pane is your clinical decision support activation. Now this here relates or correlates back to meaningful use, stage 1, stage 2. Meaningful use has now been dissolved and morphed into MIPS, and it combined value-based reporting, PQRS, along with meaningful use. So this clinical decision support here is more of a historical documentation because there are practices who did have Care Tracker for meaningful use stage 1 and meaningful use stage 2. And for auditing purposes, because for meaningful use, they had to activate either 1 clinical decision support rule or 5, depending on which stage you were in. And this is where you would activate those particular decision support rules with inside a Care Tracker. This today is no longer used. It has been replaced from our POP Health feature, which now tracks all of the ECQMs within inside of the program. So this is just here for historical purposes because, again, we do have practices who did participate in meaningful use years ago. So we need to have that for auditing purposes. So you'll see that you have an all, you can see complete, incomplete, you can show your inactive. So these are all the ones that were set up for this particular practice. And also based off of this patient and the criteria for those clinical decision support rules. Those have been now replaced by eCQMs, electronic CQMs, and now would be mostly completed underneath your history pane or within a patient's progress note. If you have any further questions or need any more assistance, please reach out to your support entity, and that way they'll be able to assist you. Thank you.